Namaste and good afternoon. Welcome to today's Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram and I'm very happy to see you all. As you are aware, we have been running a whole series on stroke over this month called Spot a Stroke Fast. The aim of this series has been to discuss with you all different aspects of stroke, especially the vital life-saving importance of recognizing stroke symptoms early and getting treatment fast to get good outcomes. We've also been discussing innovations and specific aspects of the latest in stroke care and management. Stroke is a leading cause of death and disability worldwide. But following a stroke, most patients will spontaneously regain some degree of lost motor function, but a lot depends on the timeliness of treatment and also where the treatment is given, what kind of a multidisciplinary team is providing the treatment, what kind of facilities are available, and also, very importantly, what kind of post-stroke rehabilitative therapy is given for the patient. Today, we are going to discuss all about stroke rehabilitation. We're going to discuss about all the exciting new developments in this field and how a patient can be brought to a normal, almost a near normal or even a normal degree of functioning because of rehabilitation. And particularly, we are going to discuss about some potential very promising therapies for stroke rehabilitation and also for optimal recovery of motor function after stroke, which involves both brain stimulation as in NIMS, that is the non-invasive magnetic stimulation, as well as deep brain stimulation. These are all new strategies that give hope to patients who have suffered a stroke and have remained paralyzed after a stroke. It's an opportunity to allow our patients to gain function and independence. To discuss this entire topic about brain stimulation in stroke recovery and other rehabilitative methods, I'm delighted to welcome Dr. Mukesh Sharma, Senior Consultant, Department of Neurology and Interventional Surgery, Apollo Hospitals, Ahmedabad. Dr. Mukesh Sharma has worked for over 12 years in the field of neurology and has expertise, particularly in stroke and intervention neurology. He has done more than 2,000 interventional neurological procedures, over 750 intravenous thrombolytic treatments for stroke, over 250 mechanical thrombectomies for stroke, for acute stroke, over 200 carotid artery stents, over 200 aneurysm coilings, over 100 intracranial artery stentings, over 50 AVM embolizations. And he is also particularly interested in the treatment of acute stroke and rehabilitation, movement disorders, Botox, headache treatment, and also the first neurophysician who trained as an interventional neurologist in the state of Gujarat. He has been invited as a guest speaker in various national and international neurology forums, conferences, and published many papers, and also is an organizing secretary of the Society of Neurovascular Interventions, India, as well as the present secretary of the Ahmedabad Neurological Association. And he has the distinction of having treated more than 15,000 neurological patients so far from all over India and all over the world, really. Welcome, Dr. Mukesh Sharma, to this Facebook Live session. Thank you so much for joining us. And over to you to tell us all about post-stroke recovery, rehabilitation, and other strategies.
Thank you, Dr. Srinidhi, for kind introduction. Hello, everyone, viewer. Today, this is the Stroke Awareness Week is going on. After a few days, on 29th October, we have the Stroke Day. So our aim to increase the stroke awareness all over the world. Why we want to increase the stroke awareness, I would like to tell you. The stroke is leading cause of disability all over the world. And it's a third leading cause of death. In India itself, every 20-30 seconds, somebody is getting the stroke. So numbers are huge. And the unfortunate part, that most of the stroke is not recognized on time, that because of the lack of awareness among the general public as well as local physicians about the diagnosis as well as the treatment which is available right now. If we treat patient on time or early part of the stroke onset, there is a fair chances patient can recover. Okay, and I want to tell you that the stroke is happen because of the interruption of the blood supply of the some area of the brain, which is may happen because of the blockage of the artery or because of the hemorrhage itself. But most of the time, the 85% time it's happened because of the blockage of the artery. And if you can open up that artery on time, you can save that area. Okay, and we have the two type of the treatment in acute setting, like the to dissolve that clot, which is related to the blockage of the artery, and that is called thrombolysis, which can be done up to 4.5 hours. And opening of the blood vessels is called the thrombectomy or stroke intervention, which can be done in almost all cases with a large artery stroke up to 6 hours, and some individual up to 24 hours. So this is the treatment available, but that is only possible if you recognize a stroke on time or reaching in that hospital that is called stroke ready hospital, where MRI, CT scan, neurophysician or cath lab is available, so you can get the proper treatment on time. So once it is happened and you are not able to get this kind of a treatment and you are not recover, then the only thing is available is a rehabilitation part, which is very very important in a functional recovery. Uh, with the stroke, most of the patient they have the paralysis in one part of the body, like left side upper limb and lower limb, they are not able to move, or on the right side they are not able to move. Okay, that is called the hemiplegia. And other than that, they can have the speech problem, they can have the cognition problem, they can have the visual problems. So in all the part, according to what they have, we need a we have to do the rehabilitation of those patients. And rehabilitation and acute stroke start from day one. Okay, in a day one, the rehabilitation is to prevent the complications which may happen in acute phase of the stroke. Okay, and usually that complications can happen in the next 10 or 15 days after the stroke. Okay, like some patient may develop the pneumonia uh, because of aspiration, whatever they have in the mouth, they can aspirate those part, and patient can develop the aspiration pneumonia. Okay, on lying on continuously on the bed because they are not able to move around, they can develop the bed sores. Okay, so to prevent these complications, we have to mobilize patient immediately as soon as the patient condition is better. So rehabilitation for the chest part, we start immediately on day one and start the moving the patient. If he is or she is not on ventilator, sometime the larger stroke patient may need to protect their lungs and heart, we have to put on those of patient on the ventilator. If they are not, we usually start the mobilization of the patient on day second, day third to prevent uh, bed sores. Other than that, if they are lying on the bed, they can develop the venous sinus thrombosis of legs. Okay, again, mobility of the patient after the stroke by moving the limbs, particularly that affected limb, we can prevent the formation of the clot on leg vessels, and we can prevent the thrombosis of those veins, and that may complicated as a PE, that is called pulmonary embolization, which like what is the pulmonary embolization? If the clot from the leg vein goes in the lungs, patient can have uh, patient can die. Okay, so to prevent these kind of the complication in acute stage, we have to start the rehabilitation part or physiotherapy part immediately after acute stroke. So once acute phase is over, patient is about to discharge. We decide about the rehabilitation part. Okay, and that rehabilitation part depend on what patient is having. Most of the patient, if they have the right side weakness, they have the speech involvement together. Okay, so in those patients, the speech therapy is very, very important together. Motor physiotherapy like limb physiotherapy. So they need both physiotherapy as well as speech therapy as a rehabilitation part. Eye patient is having the balance problem because of involvement of the small brain that is called cerebellum, or in the posterior fossa, like in the brainstem involvement. So they need a balance physiotherapy for the to maintain their balance. So there is a different physiotherapy required for the different patient, and that rehabilitation is usually individualized according to their need.
Right. So, how do you think the brain damage from a stroke can be completely reversed, or what factors actually play a role in that?
Okay, so the recovery is depend on so many factor actually. Okay, the first thing, how quick is the restoration of the blood supply in that artery. Okay, so how small is the damage. If the damage is small, patient can recover completely without doing anything. Okay, that is called minor stroke or TIA. Okay, like around 15 to 20% of the patient, they have a very transient weakness and they recover from that phase in the next few hours. So because there is a damage is very small, and it is not affecting the eloquent area of particularly brain area, so they recover very fast. The second thing is how much is the patient is having the collateral actually. If that area is having the good collaterals means the artery which is blocked, but having the that area is having a collateral supply from the other part of the brain, so that brain may sustain for the longer period of time and not going to damage if you treat properly in that condition, so they recover better. Number two. Third thing depend on the what is the age of the patient. As we go uh, elderly, our brain cells, number of the cells uh, die actually. Okay, that is the normal aging process. So those who are young, they have the stroke, they have the more chances of recovery or faster recovery comparison to elderly. That is the third thing. Fourth thing is the female or male, that male usually have the more better recovery than the female. And fifth, how good you are doing the rehabilitation part involved in the rehabilitation program post stroke. That is also a main contributory in a, stroke recovery phase.
Uh, what about the whole concept of brain stimulation in stroke recovery? So, how is that done? What are the modalities?
So, like we have discussed the different factor which is affecting the individual in the recovery part. Uh, uh, it, again, it's also depend on how we are stimulating the brain. So the normal physiotherapy is the one of the part also, like when you are doing the limb exercises, even you don't have the power to move, like the patient can't move actively their limbs, but if you are doing the passively that limb, actually you are doing the two things. One, you are preventing the complications of a particular during that time. Number one. Number two, you are preventing the joint which can fuse if you are not moving those joints. Number two. Third thing, when you are doing physiotherapy and moving that paralytic limb, actually you are stimulating the different brain area. So we are indirectly stimulating the brain areas for neuroplasticity. What is actually neuroplasticity is, like brain have their cells that is called neurons, and they have the connection between each others, okay, by the different branching. and our cognition, our function, and everything depend on how many connection between the neurons are there in a particular brain. Okay, after our birth, okay, usually young individual uh, with birth, they have the particular number of the neurons. Okay, the number of the neuron is not going to go increase. With age it is going to decrease. Okay, the only thing which can increase is the connection between the different neurons. So by doing the physiotherapy we are increasing the connection between the different neuron. That is called neuroplasticity. Okay, so if we in the routine way, when we are doing the physiotherapy regularly, we are stimulating the brain in indirect way. Okay, in a brain stimulations, what we do, we directly stimulate brain area which is damaged, or that area which is actually suppressed because of the stroke. We want to stimulate that area so it start functioning because of this more connection between the different area of the brain. Okay, so brain stimulation is done in the two way. That is, the one is the non-invasive one, and second is the invasive one. That is called the deep brain stimulation. Deep brain stimulation treatment is the surgery actually which we are doing for the Parkinson patient. The Parkinson patient usually have the tremor and stiffness. To improve from those symptoms in the Parkinson patient, we do the deep brain stimulations. But it has been tried. It is experimental till now. In the stroke recovery treatment, okay, a few surgery has been done. There is not a promising result till now for the stroke patients. So in this, what they do, they stimulate the small brain, that is called cerebellum, uh, for the functional recovery of the large brain damage. Okay, that is called the deep brain stimulation. And the second is which can be done in a physiotherapy center also. That is the stimulation. That is a non-invasive one. Okay, it is done by just passing a current. Okay, in a magnet and forming the magnetic field. That is called brain stimulation by magnetic field. Okay, and the second one is the transcranial direct current stimulation. So there is a two method by we stimulate the damaged area or affected or depressed area, which is even not affected because of the stroke, but it is suppressed because it is directly connected with the brain which is damaged as already, and I totally depend on that function on the damaged area. So we can stimulate that area, and uh, uh, we can that area after repeated stimulation may start functioning as a primary area. So that is the way that the deep brain stimulation is used for the rehabilitation part.
What about non-invasive brain stimulation? Could you tell us something more about that?
So, like we discussed, like as a one is called the transcranial magnetic stimulation. The second one is the transcranial direct current stimulation. So, most commonly, which is used for the deep brain non-invasive one is the magnetic stimulation. There is a coil, okay, and it is connected directly with the current, electric current. So, once the current is passing through this coil, actually is form a magnetic field, and that magnetic field applied to the skull area which is the damage area, and given for a particular time is depend on the individual to individual, and how big is the damage, number two, and when they are starting actually rehabilitation after the stroke. So it's depend on so many things, and uh, given in the different sessions. Okay, and try to stimulate, and what we have observed, when we stimulate these areas, we can see uh, that affect in a particular group of the muscles which is controlled by that area. So it directly says when you are stimulating those brain area, you can together you can assess the activity in that hand or leg actually on those muscles. So it can be calculated by doing electrophysiology, and it can be assessed by doing the functional MRI before and after the deep brain stimulation, and it can be assessed by the investigation called EEG. So there are three methods by which we can assess the functional activity which is improving with the deep brain stimulation. Sorry, with the brain stimulation or not.
We'll just take some questions from our viewers. So, what are the risks and complications of this brain stimulation, the
So,
non-invasive?
like like in a MRI, okay, this is a magnetic field stimulations. So it cannot be given. It cannot be done in those patients who are having any metallic uh, 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 metallic hardware in their body. Okay, those who are on the pacemaker, those who are having metallic like a stent, or those who are having those who are having the metallic hardwares in their body, it cannot be done. Okay, that is totally contraindications for that. Those who are having the seizure or fits, because this electric field or magnetic field can produce the seizure, and those who are high risk for the seizures, it cannot be offered. Okay, so these are the few contraindications where it cannot be done. Third, you can have the some skin burn, you can show the seizure even though you are not on the patient. So once it is, if patient is having the seizure during the manure, so it cannot be offered. Otherwise, not significantly contraindication for the non-invasive brain stimulations.
Are there any side effects and complications?
So, like complication, I told you, patient can have the seizure. Number one. Number two, patient can have the local irritation on the skins. Okay, so these are the few side effects which may happen with the brain stimulations.
What is a wearable brain stimulator? Are they beneficial for stroke recovery?
Yeah, uh, these are the transcranial
So
uh,
they're
coils are available. Okay, like a swimming cape. Okay, so you can keep like patient can wear that swimming cape with magnetic coils, and with electric instrument, that field can be generated, and different session for the different times, according to individual, it can be given.
right. Um, is there any particular, is it like, is it that the magnetic brain stimulation, there are some types, you've said there's a transcranial one. So the question is like, is it available all over the country, and, can anybody access all these things, or where should they approach for this?
So this transcranial magnetic stimulation we are using as a diagnostic tool also. Okay, so those who are having electrophysiological machine in their department, neurology department, probably they have this transcranial magnetics coils. Okay, not the cape, which is not available all over the world. Yeah, it's available in some center. Those who are having good rehabilitation department, so that should be that is there on their rehabilitation department. But this coil probably available almost in the all neurological department, where they have the electrophysiological diagnostic studies.
Is there anything else that you would like to add? Otherwise, we will just close the session,
So
Doctor.
I want to say that you have recognition of the stroke is very, very important. That is the only way you can reach at a proper hospital. So there is a word called be fast. Each letter stands for one symptoms. So you have to remember this word. B for balance, E for eyesight, S for uh, F for
Yeah.
face weakness, S for speech, A for arm weakness. So if you have any of these symptoms, not you, your relative or your neighbor, probably patient is having a stroke, better to reach in that hospital that is called stroke ready hospital, where the MRI, neurologist or intervention facilities available, so that patient can get the timely treatment. Really timely treatment can make a huge difference in patient recovery. Now coming to the recovery part, every stroke patient who comes out from the acute phase, they recover. They recover from 2% to 100%, and that recovery depend on so many things. And that doing a regular rehabilitation, physiotherapy and speech therapy and occupational therapy make these recovery faster and more. Thank you so much.
So thank you, Dr. Sharma, and thank you, viewers, for joining in. We look forward to your comments, queries, and suggestions on our FB page. And also do contact us for further queries. You can always post your comments or contact us on our inbox. And don't forget to subscribe to our YouTube channel as well to get the latest information on all the trending healthcare topics. We will meet again soon with more and more reliable, authentic, and essential information on health and diseases. Till then, stay safe, take care, and be well. Thank you and namaste.
Thank you. Thank you so much.